Having given a brief introduction about orthopedics and myself, I would like to say a few more words which are absolutely essential and worthwhile for all the people to know. Naturally, anybody would like to know what is orthopedics, how the word orthopedics has been derived. Prior to 18th century, middle of the 18th century, there is no word orthopedics. A Greek physician by name Nicholas Andre was the first person to use the word orthopedics. Ortho being straight, pedis being a child. So they published a paper, or treatise as we call, way back in the 18th century, second half of the 18th century, and then call it as orthopedics. That was about the people, the children with deformities. Those deformities Nicholas Andre has corrected and then presented to the group of European physicians. People like the word orthopedics. That's how the word orthopedics has come into existence. But then on, people started calling it as orthopedics. Actually, orthopedics was a subject which came into existence regularly only in the late 19th century. This is also because of the efforts of Sir Hugh Owen Thomas, a great English orthopedic surgeon. Prior to that, most of the injuries were being treated by unqualified people with some background of training by their ancestors. It is still going on in our country, India, and of course some other countries also. But thanks to Sir Hugh Owen Thomas, orthopedic subject has picked up, and his nephew Robert Jones also contributed a lot of this orthopedic subject. Simultaneously, a lot of people from USA and Germany and other countries started working more and more on orthopedics. The subject of orthopedics became easier after the advent of X-rays. So before that there were no X-rays. People were guessing, and with their great dexterity and presence of mind and observation, they were able to treat the patients. Now with the advent of X-rays, people are able to make out what exactly is wrong with their bones, they are broken, displaced or dislocated. There is a great advantage we had with the availability of the X-rays. One more thing that contributed to the development of any medical and surgical subject, including orthopedics, is anesthesia. Around about 1847, anesthesia has come into vogue, and thanks to anesthesia, people were able to perform painless surgeries. But of course, the anesthesia itself got completely revolutionized in the last 20-30 years. A sea change of, look at the anesthesia management in the last 30-40 years when we were just medical students and at present. Now, any type of patient, the anesthetist can manage. This is not possible a few decades ago. So there is another great subject of anesthesia which is responsible for development of orthopedics. Then one more thing is our people from metallurgy, physics, biophysics, etc. All those things have contributed a lot for development of implants which are very, very essential for orthopedics. Actually, the concept of treating orthopedics has evolved more and more during World War I, where the orthopedic surgeons in army had to come across thousands and thousands of fracture cases, crush injuries, amputations, all those things. In a way, the two wars have contributed a lot for evolution of orthopedics. So, one more important landmark in development of medicine in general is the discovery of penicillin by Sir Alexander Fleming. Thanks to him, the antibiotics have come into existence. Knowing of antibiotic therapy and what are the medicines to be used, appropriate antibiotics at an appropriate time for a period of time which is necessary, has contributed a lot in preventing infections. And so is the Department of Microbiology, which has helped us in identifying the organisms and then telling us the particular patient has got this particular kind of infection which is amenable to a particular kind of antibiotic. So with these developments in medicine, the entire thing has revolutionized the management of orthopedic problems. Of late, you come across the word scanning. This is another thing which has improved considerably the aspects of management of orthopedic problems. One great thing is CT scan or CAT scan as we call it, which makes the body into several slices like chips, potato chips, and we can clearly make out where exactly the problem is. And so is the MRI. It is magnetic resonance imaging. This gives more details of various soft tissues surrounding the bones. So previously, most of the things, X-rays and CT scans were giving more information about the bones in general. But with MRI, things have improved considerably, and we are able to localize and then demarcate the soft tissue problems in orthopedic conditions. Now, one more thing is technetium bone scan. There is an isotope scan with technetium. It gives, because of a single injection, the radiologist, the managing radioisotope study, will tell us where exactly the lesion is located in the entire body in a single picture. Not only that, they will be able to give us an idea about the nature of the problem. Even though they cannot give us specific diagnosis, they will be able to guide us to a large extent. This makes the things easier for us for diagnosis. So these things, orthopedics has jumped leaps and bounds in the last 50 years. And the latest things are the various types of implants, where different types of implants, like for example, started with silver and then stainless steel. Now we are able to get implants which don't make a noise when you go to the airports and all that. That is the latest type of implants we have got, and which are useful now. They are using nowadays those things. And not only that, one more thing which has contributed particularly to this orthopedics is the mountaineering in Germany and Switzerland and Austria. There, post-Second World War, a lot of patients without much development in the hospital beds are getting admitted, and they were feeling it very difficult to treat so many patients in such a short time. That's why the NYOH technique that is developed by people. So prior to that, most of the fractures were being treated with plaster Paris, and other types of immobilization. Here, with the advent of this AO technique, which has completely revolutionized the concept of treatment of fractures, where practically every fracture can be fixed by appropriate metallic implants, and then to make the patient go back home at the earliest opportunity within a couple of days. So with this, they have developed a lot of implants which are useful for fixing up the fractures, and sometimes making it so easy that the patients could use their own hand immediately after the surgery in a couple of days. Not only that, previously when plaster Paris was being applied, we used to immobilize them for a very, very long time. So what happened? It used to produce the stiffness of joints which are immobilized. So it used to take long rehabilitation period for them to recover completely. So with these techniques and all that, orthopedics has become a great subject, very useful to the people, and make the people go back. The motto of orthopedics people is mobility is life.